The cardiovascular system contains the heart and blood vessels, including arteries and veins. This system transports blood, oxygen, and nutrients throughout the body. Arteries for catheter insertion. During heart catheterization, the skin is numbed and a long, flexible tube called a catheter is inserted into either the femoral artery or the radial artery. Catheter insertion. During heart catheterization through the radial artery, the catheter is inserted into the radial artery through a small puncture at the wrist. In some patients, radial artery access is attempted, but the artery is too tortuous to successfully enter. In those cases, access through the femoral artery is performed. In heart catheterization through the radial artery, the catheter continues up the forearm through the radial artery. Catheter advancement to heart. From the radial artery, the catheter travels up the arm through several connecting arteries until it reaches the heart. Once in the heart, the catheter can be used to evaluate a variety of conditions, including malfunction of heart muscle, heart valve disease, and coronary artery disease. Coronary angiography. By using dye that can be seen on an X-ray, a cardiologist is able to see the coronary arteries to determine if there are any blockages. This is called coronary angiography.